Welcome to the Althing Health Podcast again, where discussions with engaging health innovators are shared. In this episode, we will continue our conversation about trauma and trauma-informed care with Christy, Althing's licensed independent clinical social worker. Before we dive into our conversation, we wanted to thank you for listening to our first episode. And if anything comes up while you're listening to our conversations, please don't hesitate to add any comments, questions, or thoughts, and we will review them and address them at the beginning of our next episode. As always, a quick reminder, this podcast about trauma includes potential triggers such as sexual assault, physical and emotional abuse, historical traumatic events, and conversations of mental health diagnosis. With that said, welcome back, Christy. We are excited to have you again today, and we are looking forward to continuing our conversation about trauma.
Yeah, thank you. Very excited to be back.
So we have planned to do a little recap on the types of traumas we talked about last time, and a quick recap on the comorbidity of trauma and substance use addictions before we then dive into the triggers, and we will talk about trauma-informed care. And our plan is to wrap it up with some trauma-informed care de-escalation techniques. Does that sound right?
Yep, absolutely.
All right.
Yeah, so I won't go as much in depth about the different types of trauma. This is really just a recap, just to remind folks of what we learned last time. So those different types of trauma, we talked about acute trauma. As a reminder, this is a single episode that might have occurred, something like a car accident, loss of a loved one, an event that occurs in your life that just is so impactful that it's something that stays with you throughout and can absolutely lead to triggers in the future. Complex trauma, this is going to be exactly what it sounds like. It's going to be very complex. This is trauma that experienced at probably an early age. Multiple events occurred. Complex trauma often brought on by a loved one. Highly invasive. Impacts cognitive functioning, emotional functioning, a lot of dysregulation that comes with complex trauma. We talked about sanctuary trauma, which is trauma experienced by folks that are in places that is meant to be safe. So again, foster care, hospital, maybe a school, things like that. And then vicarious trauma, we talked about that. This is trauma experienced mostly by helping professions. So those of us who are working closely with folks who are experiencing trauma. And when that trauma starts to kind of rub off on us, and all of a sudden we start to notice that our viewpoints of the world are changing, maybe we're starting to experience some symptoms ourselves in terms of anxiety or depression. Maybe we're more irritable. So vicarious trauma, definitely something that we have to be careful about, and something that I talk a lot more about in another training that I do called secondary traumatic stress, how we as helping professionals keep ourselves safe. So, and then finally, we talked about historical trauma, and this is trauma experienced by communities of people who have had, an incredible event happen in their communities, whether that be something like, slavery with folks of African descent, folks of Hispanic descent, with the things that occur in their country that lead to them having to flee, wars that occur, things like that. So that historical trauma that happens, but it's passed down from generation to generation and really impacts how a person might show up in the world based on the cultural trauma that they've experienced. So those are the different types of trauma. We also talked about how oftentimes when we experience trauma and the symptoms that come with trauma, right? Anxiety, panic attacks, depression. Sometimes as humans, we're always going to look for a way to alleviate those symptoms. And sometimes what happens is that we find that drugs and alcohol work really well in alleviating those symptoms. They don't make them go away. They don't make the trauma any less invasive, but they absolutely cover, they almost, act as like a, I can't think of the word. When you go into surgery and they give you anesthesia, it acts as an anesthetic. Just kind of makes it a little bit more bearable to get through that trauma. And so there's absolutely this correlation between trauma and using substances to cope with that trauma. And it's really important to know about that when we're talking about trauma-informed care, because having that understanding goes a long way towards discrediting any assumptions that might be made about why somebody uses substances, or their ability to just stop using it. Because for those of us who don't have addictions to substances, it can be kind of hard to understand how a person who's literally hit rock bottom isn't able to just snap their fingers and stop using them, right?
Mhm.
Hard for us to understand if we haven't experienced the things that they've experienced that have led to them. So it's very important to understand that connection between trauma and then using whatever methods they have to try to overcome the symptoms of that trauma. So
Mhm. And in preparation of this episode too, I did some research and pulled some stats, and I found that approximately 75% of individuals with a substance use disorder also have experienced trauma at some point in their lives. So that's exactly what you just pointed out. There is this correlation. And interestingly too, that 75% of substance use generally starts by the age of 25. Um,
Mm-hmm.
so, it is related to some of the childhood traumas that we talked about earlier. And like you pointed out, just a way to cope with any events that occurred, or any, situations people are in.
Yeah. I mean, because if you think about it, yes, the healthy response to trying to process through your trauma is going to be something like psychotherapy. Maybe we use medications, right? Maybe we find those
Mhm.
healthier ways of processing through the trauma, but that's only if the person is recognizing that how they're feeling is a result of the trauma, right? And we're going to talk about triggers here in a second. I mean, there are some people who are triggered by something, they have no idea where it's coming from. Maybe
Mhm.
they've repressed the trauma. Maybe they aren't in a place to be able to make that correlation between the reason they're feeling the way they are and the trauma that they've experienced. And so they don't recognize the need to go to therapy or to do medication. So if you don't have that knowledge, and if you don't have the resources available to you to access appropriate healthcare to
Mhm.
address that, again, we as humans are going to do whatever we need to do to feel comfortable. We
Right.
want that convenience. We do not like sitting in discomfort, and we're going to do whatever we have to do. And if that means going and downing a 12-pack so you can sleep that night, that's what you're
Mhm.
going to do. So
Mhm.
it's important to understand
Mhm.
why they're turning to the substances they're turning to essentially save their life.
Right.
Yeah. So let's get into triggers. So what are triggers? Triggers are literally, I mean, it could be a person, it could be a place, a thing, a time, event, a date, a smell, a texture. Literally, a trigger can be anything. And triggers are not cookie cutter, right? What is something that might trigger me is something that you, Katya, might experience and feel nothing, because we've not had the same experiences. Um,
Right.
let's say that a person who experienced an acute traumatic episode of a car accident, right before the car crash, there was a horn. And so now, anytime somebody sounds their horn, that person immediately is triggered to the point where their heart starts racing. They maybe start sweating. Sometimes comes with like uh, uh, your stomach starts to hurt. You just want to get out of that situation. Your body, your flight or fight or freeze response immediately engages and tells you you need to change something right now. We are not safe. We have to get out of this situation, right? But if you've never been in a car accident, or you've never had a
Mhm.
horn beep right before that car accident, that's not something that is going to trigger you. So it's
Mhm.
important to remember that triggers are going to be different for everybody, and we're not always going to understand it. Triggers could be, let's say that you were abused by a man, when you were younger, and later, 20 years later, as an adult, you run into a man who looks eerily similar to that adult that hurt you when you were younger, and all of a sudden your body is telling you to get away from that person, and you may not even know why, but you know that you have to get away from this person. So maybe your responses to that person come off as angry, scared. That person's going to have no idea why that you're acting that way towards them, and maybe you don't, but you've been triggered. And that's kind of where these triggers occur. Some common triggers that I will say for folks who have experienced trauma, a big one is having a lack of control, because when you're experiencing a traumatic event, in that moment, you have no control over that. And so in the future, if you're in a situation which you have no control, that can be a trigger. That can be we need to get the heck out of here. We need to keep ourselves safe. We need to do that by all means necessary, whether that's screaming or crying or throwing things, right? Threats or feeling threatened, that can be a huge trigger. Sometimes isolation can be a trigger. Being told what to do, again, kind of takes away that control factor. Having a lack of privacy can be kind of triggering. Separation or loss can be triggering. Being touched or watched, that could absolutely be triggering. Loud noises could be triggering. Intrusiveness could be triggering. Being locked in a room, being ignored, even as, getting condescending looks, right? And this is where trauma-informed care becomes incredibly important, because how we are in somebody's presence, anything could potentially be a trigger. And trauma-informed care is recognizing that it could be a trigger. As a social worker, when I first started at the county, I was pretty new. I was only a year or two in, and I can tell you that I really didn't have a lot of training on trauma at that point. I didn't have trauma training or trauma-informed care training in my undergrad. We just kind of, brushed over the surface of it, but we didn't really go into detail. I didn't know nearly what I know now, right? And so I was pretty new. And I remember I had this client, and I worked for this program in which we had to do an assessment. And so we had to, it's kind of uncomfortable, because you meet this client, and then the same day you meet them for the first time, you are asking them a whole lot of invasive questions, which in itself can be pretty triggering. And then we have to create a treatment plan. So in this program, we assess you, we figure out what your needs are. And the people that we worked with were all people who had mental health diagnoses. And I would safely say the majority of them, 95%, if I had to guess, all also had trauma experiences. And so we would do this assessment, and then with the place that I worked, in the program that I worked, we had certain terminology. And so I'm working with this client who, again, I just met, but we were actually getting along really great. I mean, we had amazing rapport. We were laughing. She was very open about some of the questions being kind of invasive. And so I kind of pulled back a little bit, and I just kind of followed her lead. But overall, I felt like it went really well. But when we got to the treatment plan, one of the terminologies that we used is that our clients were known as consumers, and our providers that we got, them connected to provide them with resources were known as vendors. And so I asked her, what vendors do you want on your treatment plan? And she just got the weirdest look on her face. And she's like, what? Why are you calling them vendors? And I said, oh, I don't know. That's the program. That's the terminology we've been told we have to use. So I just use it. I don't really know why. And she's like, oh, okay. And then she moved on. But I could definitely tell that something had shifted in the air. Okay. So the very next day I get to work, and come to find out that this client had attempted to take her own life the night before. And I know, I was so confused. I was like, but we had a really good, there was no indication that she was suicidal. I had no idea what was going on. And I went to the inpatient unit that she was at, and I met with her, and I asked her if she was comfortable, if she could kind of tell me, what happened? Because yesterday I saw you and we seemed to be doing really well. And now today, what's going on? And she trusted me enough, and I'm so grateful because it was such a learning experience for me. She trusted me enough to tell me that when she was younger, her parents owned a grocery store,
Mm-hmm.
and she would play in the grocery store all the time. And one day she had been sexually assaulted by one of their vendors.
Oh.
So when I said that word, it immediately triggered her, and it brought a ton of trauma back to her all at once. And me not realizing what I had done, just moved on like everything was fine. But then when I left her and she was left to kind of sit in that memory, that
Mm-hmm.
emotional dysregulation that comes with that complex trauma came up for her, and she didn't know how else to deal with it by other than trying to take her own life. Now, the reality is there is no way I could have known that
Yes.
that word was going to trigger her. And
Yes.
that's the key here, because you won't always know that you could potentially be triggering somebody. But the second I knew that those words, consumer and vendor, were a trigger for her, I never used them again with her.
Mm-hmm.
I changed my terminology. You don't know until you know. But then once you know, now it's your responsibility to change your approach. And
Mm-hmm.
so I use that story as kind of an example of, if you inadvertently trigger somebody, it's okay, because we are not always going to know what other people's triggers are, because we don't know what they've been through.
Mm-hmm.
But then once you know, trauma-informed care means that it is your responsibility to change your terminology or change your approach moving forward. The more you get to know somebody, the more you can understand what their triggers are, and then you make the changes you need to make. So
Yeah,
triggers are
and that
incredibly,
actually,
yeah.
yeah, brings up a question for me, Christy, as we are thinking about this. So, let's assume your the client that you worked with there had this event during childhood. So now the
Mhm.
question is it normal to experience the triggers like pretty much immediately after the traumatic event, or can it sometimes take years for triggers to actually start occurring? Or do you have any insights in that regard?
No, I would say absolutely that there could potentially be a waiting period, that these triggers don't come up for you immediately. And
Mhm.
again, we have to know that what we're experiencing are triggers, because
Mhm.
sometimes we don't make that correlation. Take, for example, if you are somebody who works with kids and you
Mhm.
have a 4-year-old who was sexually assaulted, or maybe they were abused, or
Mhm.
maybe they got hurt or in a car accident, their brains aren't developed enough to recognize their triggers. And
Mhm.
so let's say they're in school and something inadvertently triggers them, whether it's a smell, a sound, a person, right?
Mhm. Mhm.
Anything. How are they going to respond? A
Right.
4-year-old. They're
Mhm.
going to freak out. They're going to start screaming, because again, it doesn't matter how old you are. Your body's going to internally do the same thing, which is that fight or flight or
Yes.
freeze or fawn, all the F's, right?
Yeah.
So again, it's that idea of, unfortunately, in history, we like to, if a child is acting out, we throw labels on them. The oppositional defiant disorder, ADHD, intermittent explosive disorder, or this child has had a trauma in their life. And once we recognize that this certain thing triggered them, now it's our responsibility to protect them, to shield them from that trigger,
Mhm.
um, moving forward from that point, because they're not quite in a place to be able to recognize that trigger. And while, yes, this is an example for a 4-year-old, this could be inputted with any number of age. It doesn't
Okay.
matter how old you are, and it doesn't matter when it happens. Some people who experience it, and I'm sure everybody on this call, let's take, for example, if you get into like a conversation or an argument with somebody, and maybe you don't respond the best, but then 2 hours later or later that night when you're laying in bed, what comes up for you? I should have said
Mhm.
this, or I should have, right? We don't always know in the moment how to
Yeah.
respond or anything like that, but later on when it starts to hit us, then we start to know. So to answer your question, yes, there is no, again, when it comes to trauma, there is no cookie cutter understanding of it. It's different for everybody, and it can hit you all at different times. Um, Again, if you're a person who experienced abuse and then 20 years goes by And there is nothing that occurs that triggers that. And then all of a sudden, 20 years later, a smell hits you or a song hits you, and boom, all of a sudden you're triggered and you're responding accordingly. Yeah. Are we ready to move on?
Yeah, I think there's just
Okay.
a lot to take in here, you know,
Yeah.
and I think it also has a lot to do with an individual's awareness and recognizing what is happening in your, you know, in these situations, you know.
Mhm.
And sometimes, like you said, you might not, you might feel that it's triggering something in you right now, but in a conversation, you might just continue the conversation. But then
Mhm.
when you have time to think about that,
Yep.
exactly like you described, you go to bed and you try to sleep, and suddenly, you know, your thoughts are coming back into your head and you just keep thinking about that. You know, that's also how do you reflect on these things? And then, you know, what actions do you take after that?
Yeah.
What coping mechanisms do you have? And I think that's where I think really the trauma-informed care approach comes in, just to being aware that this might be a trigger, this might be related to the trauma that I have experienced, and what can I do to get proper help?
Mm-hmm. And again, not everybody is in, I mean, people are all in a different place of their trauma recovery. And
Mhm.
some people might experience a trigger and then later on recognize that, you know what, something didn't sit right with me. And I need
Mhm.
to like do some work to figure out what all is going on here.
Mhm.
Some people may be like, well, that didn't sit right with me. I'm going to go drink,
Mhm.
right? That didn't sit right with me. I'm going to smoke a bowl or whatever, insert
Yep.
substance here, right?
Yep.
Or some people may just completely ignore it.
Yep.
Avoidance is a real, it is a coping mechanism. Not saying it's necessarily a healthy coping mechanism, but avoidance is a very, very common coping mechanism. But that trauma doesn't go away. That just keeps getting buried, and
Mhm.
eventually it will come out.
Mhm.
Yeah.
Well, let's chat about the trauma-informed
Yeah.
care.
Well, and I bring up triggers because that when we are, again, when we're in a helping profession and let's say we're working with clients and we're helping them get, set up with homeless services or housing or food share or,
Mhm.
again, whatever it is that you might be helping them with, and they are getting what you consider irrationally angry. Maybe they're screaming at you. Maybe, let's say that you work at a hospital and somebody comes in and they're experiencing something and it's super busy and you ask them to wait and they've been waiting an hour and they come up and they start screaming at you. Our go-to is like, oh, well, what the heck is wrong with them? Right? Like, why are they ruining my
Right.
day? Trauma
Yeah.
informed care is being able to recognize that there might be something more to that story, that they may be triggered right now. And that's
Mhm.
why they're responding the way that they are. Um, and I think that sometimes there's a little bit of confusion with trauma informed care, that some people think that trauma informed care means um, excusing the behavior, right? Like if somebody is triggered and they freak out and they start punching everybody around them, um, you know, trauma informed care is saying just, let them off the hook because they're, clearly triggered and traumatized and that's not what trauma informed care is. We are not excusing the behavior. We're simply working to try to understand it and to make sure that we are responding to them in a way that doesn't further escalate their trauma or their triggers. So, we're not saying that they can't be held accountable for how they respond, because in reality, if their trauma responses are causing that kind of behavior, it could be preventing them or creating these barriers for them when it comes to something like housing or employment or interpersonal relationships. And so we really want to make sure that we are understanding why they may be responding that way. So uh,
Yeah.
we really need to presume that the people we work with um, have a history of trauma. Even if we can't see it, we need to practice universal precautions by creating systems of care that are trauma informed. So even if there's no trauma there, okay, cool. I mean, that's awesome that there's no trauma there. But
Yeah.
it's okay though. I mean, you could still be trauma informed even if there's no trauma there. But if being trauma informed, just in case they do have trauma, I would encourage folks that when utilizing trauma-informed care approaches, it doesn't just go with like clients and students and patients, right? Trauma-informed care could be used in any aspect, with relatives, with friends, with coworkers. That cashier at Quick Trip who's super mad at you for asking for an extra bag or something,
Yep.
right? Like we don't like being treated poorly, so we have a tendency to lash back, right? But what if that barista at Starbucks, or what if that cashier at Quick Trip, what if something just happened that triggered them? What if the customer before you said something or smelled in a way that triggered their trauma, and they're responding because their body is inside going, what's happening? We have to get out of here. We have to protect ourselves. And so they're kind of freaking out. And so again, using trauma-informed approach is recognizing that if somebody is responding to you in a negative way, it likely has nothing to do with you, and you need to act and treat them as though maybe they could be triggered in that moment. So I remember, and I think I mentioned in our last podcast that I have a history of trauma that I experienced, which is kind of what propelled me to get into this. And I remember that I was working, so there was a time in my life when I too didn't treat my trauma in a positive way. I used substances myself to try to cope with the symptoms of the trauma. There was a point at which I used self-harm to address some of the trauma. And I mean, this was many, many years ago, but these are still scars that I have today, that are constant reminders of the journey that I went on to get to the place of being ready to cope with my trauma in a healthy way. But I still have scars nonetheless. And I remember that I was working at a job with a bunch of other social workers, and we were on a break one day, and we were just chatting away. We were having a good time. We always had a good time. My coworkers and I always just had a blast. And I have some scars on my arm that are pretty blatantly self-harm scars. And she saw them, and her response was, "Oh, were you an idiot who self-harmed yourself? Like, did you do that to yourself?" And she said it so accusatory. And I was so taken back. Like, I was shocked, and I was embarrassed and ashamed, like all of it. And I lied. I said, "Oh no, I burned myself on, a pizza oven," because I, used to work at a pizza store or whatever. But I lied because how she came at me was so triggering and shameful. And here's the thing about this coworker: she was one of the best advocates for her clients I had ever met. Sometimes even today in my career, I model my approach to clients and advocacy work for my clients after her, because she was such a good advocate for her clients, and there's no way she ever would have talked to her clients that way. And I think if this coworker had known my history, she would have never said it to me either. But I'm not somebody who goes around introducing myself as, "Hi, I'm Christy. I have a ton of trauma." I kind of gotta, that's just not something. And at that time, I didn't do trauma-informed care presentations. At that time, I still had a lot of shame around my trauma. So I didn't. So it was very triggering, and it absolutely impacted me for the rest of the day. And like a couple of weeks, I just, I was wearing sweatshirts, and it was, 80-degree weather out, 90-degree weather out. So that's just an example of this idea of universal trauma-informed care. It's not only with our clients, it's with everybody, because you never know when something you say to somebody could be triggering for them.
Right.
I would encourage everybody, even if you know for a fact that there is no trauma there, maybe just be trauma-informed anyway.
Yeah. And, interestingly, related to that story, I mean, you talk to professionals in your field, and you had mentioned earlier, trauma-informed care was not an aspect in your education. It was
Mm-mm.
something that you added on after the fact. So, and I think
Mhm.
there's some opportunity here, to really increase awareness amongst professionals that, hey, there is something else you might want to look at.
Yeah, absolutely. And like I said, this woman, I mean, I would never say a bad thing about her. I mean, I don't say bad things about people in general, but her specifically, she was just such an amazing woman. And I think if she had known what she had done to me in that
Yeah,
moment,
yeah,
she would be devastated.
yeah,
Right. So
yeah.
it's you just don't know. And you just don't want to take the chance that something you could be saying is off-putting. And I mean, I've had coworkers who have had, miscarriages before, and we're sitting in a
Mhm.
group and somebody else is talking about how, and this is really crass and, trigger warning, but I remember a specific situation where a colleague of ours was saying that her daughter was pregnant and she was crossing her fingers for a miscarriage.
Wow. Yeah.
Right. And my coworker's over here going pale because she just had her third miscarriage. And it's just, I, we have to be more mindful of
Yes.
the things we
Yes.
say, regardless of where we are, who we're with, because that's just not, I mean, there's a lot of damage done there and it absolutely impacts relationships too. So,
Absolutely. Yes.
trauma informed care, it's a culture change. This is
Mhm.
not something you just do once. Listening to this podcast, good, now I'm trauma informed. No, you really have to look at all of your communications and processes with people in your life and change your wording, change the way you think about their responses to you. Trauma informed care focuses on how trauma may affect an individual's life and their responses to behavioral health services. Um,
Mhm.
it's not an intervention to address PTSD. It's not therapy, right? Trauma
Mhm.
informed care doesn't now make you a therapist. Congratulations. No,
Mhm.
like that's an actual therapist needs to actually treat the PTSD. But trauma informed care again it focuses on not re-traumatizing them.
Mhm.
Trauma informed care is, instead of saying what's wrong with you, it's saying what happened to you.
Yeah.
What's right with you. There are four key elements to a trauma-informed approach. It's the four R's. Realizing the prevalence of trauma, which we've talked about at
Mhm.
length in our last one, how common trauma is for everybody. It's recognizing how trauma can affect us. So
Mhm.
again, those trauma responses, when we're talking about the fight or flight, and how our bodies tell us that we need to do what we need to do to protect ourselves in that moment.
Mhm.
It's responding by putting this knowledge into practice. So when you are talking with somebody, when you are engaging with somebody, um, being mindful of how you engage with them, and then resisting that re-traumatization.
Mhm.
So again, four key elements: realizing, recognizing, responding, and resisting re-traumatization. Those are key.
Yeah, and I like your point that you made when you said this really applies to all areas of our life, right? If we have a conversation with a friend we didn't talk to in a long time, just be aware that there might be something that happened that you
Mm,
don't know yet. That's
yeah,
part of their story. Or when we interact with other people at the grocery store, or when we do activities of our daily lives, just being aware and following those elements that you had just mentioned. And I like when you said it's not just trauma informed care, it's the trauma informed approach.
yeah, yep,
I think that really resonated well with me.
yeah, absolutely. Yeah, and so when we're talking about that trauma informed approach, I have a couple recommendations for people on,
Mhm.
if they're engaging with somebody. Again, when we're going into this with this assumption that there might be some trauma under there, so let's be careful with how we present ourselves. A couple things
Mhm.
you can do: avoid forcing eye contact. Some
Okay.
people aren't interested in, and I know that in some cultures, eye contact is a sign of respect, right? It's a sign of
Mhm.
active listening. Not
Mhm.
everybody is in a place to be able to force eye contact with you. So if
Mhm.
they're looking away, don't take that personally and don't force that eye contact. It might just be
Mhm.
that they're not comfortable, and a trauma-informed approach is making sure that everything you're doing is making sure that they're comfortable. So
Mhm.
don't, avoid forcing eye contact. Be aware of your proximity. Now, when I first made this presentation, it was pre-COVID, so that was actually an important thing. Post-COVID, we tend to be aware of our proximity anyway.
Mhm.
But keep doing that. There's no need to be right up close getting in people's faces.
Yeah.
So I would encourage you to just kind of be aware of where you are when you're around them. Avoid asking too many unnecessary questions. And
Mhm.
and this is more geared towards folks, again, who are in helping professions, and like my example earlier with my client, where we had to ask, I mean, that assessment was at least 20 questions long, asking incredibly very invasive questions
Mhm.
about everything of essentially why.
Yeah.
Do you need help, right? So how
Yeah.
do I get away with that when that's my job? Like, that's literally part of my job, is going through this assessment. And if I don't go through this assessment and we get audited by the insurance company, now we get a finding because Christy didn't do a thorough enough job on her assessment. So this does get very difficult sometimes, but I would encourage you that when we are asking these questions, and let's say you have a follow-up question,
Mhm.
maybe do some thinking about whether or not is it a necessary question for the purposes of whatever you're asking the question for, or are you asking out of curiosity?
Yeah.
If you're asking out of curiosity, you don't need to know. I mean,
Mhm.
that's the avoiding too many unnecessary questions, is really being very conscious and mindful of the questions you're asking and the purposes for it.
Mhm.
I would encourage folks to pay attention to the tone of your voice, right? Because again, that tone, that can be triggering to some folks. If you have a very authoritative tone, absolutely that can be triggering, especially if somebody who has had trauma related to, like, the police, whether it's, you
Yeah.
know, they were a child and the police, stormed into their house and arrested their parents or something, or their sibling, or let's say that they were involved in a shooting of some sort, again with the police. Like,
Mhm.
that authoritative tone can sometimes be very triggering for people. Let's say they had a parent who was very abusive to them, and while they were abusing them, they were shouting at them. So I would just encourage folks to be very gentle with how they're speaking to somebody. um,
Mhm.
and practice. If you are somebody who has kind of that tone, like, I would say that I have a pretty forceful tone when I'm talking about something, especially if I'm passionate about it. I tend to get louder, I tend to get a bit more forceful, and that's just who I am. So I have to be
Mhm.
very mindful with my clients when I'm
Mhm.
talking about things, to just bring it down a little bit.
Yep.
Little, maybe quieter voice, maybe gentler voice. So it's something that you have to practice. Um, Another thing I would encourage, again, this is geared towards folks who are in helping professions, and let's say that they have to have meetings. Pace those client meetings. Because sometimes when we're talking about stuff, because folks need assistance, we're asking them for everything. We have a
Yeah.
lot of requirements. We have a lot of hoops that they have to jump through to get the assistance they need.
Mhm.
So if it's a long meeting and you notice that they're starting to get uncomfortable, go ahead and offer a break.
Yeah.
Or maybe you cut the session short, or the meeting short, and do another one later. We got
Mhm.
nothing but time, right? So just take your times and really watch them. Follow their cue. I would encourage, again, just to caveat that this was made before pre-COVID, ask before touching or hugging. We really don't do much of this these days, and that's okay.
Yeah.
I don't think it's necessary that we touch or hug our clients anyway. But if the mood hits you, let's go ahead and ask before we do anything more.
Yeah. Yeah.
Provide choice when possible. This is a big one, because again, when we're talking about folks who have experienced trauma, when they were experiencing that trauma, they had no control
Mhm.
over anything. So if you are in a situation in which you can offer them a choice, please do so.
Yeah.
Look for ways to offer them choices. And then be very transparent. Be honest.
Yeah.
If you're in a situation where you're not being honest with your client, I would do a lot of evaluating as to what's going on with that. So be as transparent as possible. There might be times that when you're talking to a person or a client that they're getting super emotional, and sometimes that can be uncomfortable for us too.
Hmm.
And so it might just be asking, how can I support you right now? You don't have to solve all their problems. Maybe you just ask them,
Yeah.
how can I support you right now? As opposed to saying, well, what you need to do is, because we like to do that, we humans, we problem solvers, we like to just tell people what they need to do in order to solve all their problems. So trauma-informed care is saying the words, how can I support you right now? And
Yeah.
giving them the choice of what it is that they need.
In that
Um,
regard, you brought up, we talked about it, that it's not part of the general education, of the standard programs. How do I know if a provider that I'm looking for or a therapist is
mhm.
trauma informed? How do I know that they have this special, I'm just going to call it special education or special edition in their skill set?
Yeah.
How do I know?
I think asking them, there are a couple, you said specifically therapists or providers. So
Yeah.
in the interview process, are you asking about that or during?
Yeah, like if let's say I'm an individual who had trauma and I feel like something triggered and I realize, okay, I should probably get help. How do I find a trauma informed care professional?
Okay, yeah. I mean, these days, a lot of people are, especially as a therapist, when we're putting our bio on things, we will actually say specifically that we use a trauma-informed approach.
Yeah.
But I would say that you can tell pretty quickly when you are working with somebody whether or not they're trauma informed just by this list of things. If there's somebody who's forcing eye contact and they're right in your face and their tone is loud and boisterous, and they're probably not utilizing trauma informed care. If they're not giving you any choice in the matter, they're telling you what you're gonna do, they're probably not trauma informed.
Mm-hmm.
um, let's say, just to, because I do want to cover this, let's say that you are a supervisor in charge of hiring therapists or providers. In your interview or any opportunity, ask them how they would handle certain situations or what their take is. If a client comes in presenting as this, what do you think is causing that? And if their response is laziness, if their
Mm-hmm.
response is, well, they're just addicted, they're choosing this, that's not really a trauma-informed response.
Mm-hmm.
Right?
Right.
It's be curious. Be
Mm-hmm.
curious as to why people are making choices they are, responding the way they are, as opposed to just making assumptions about why they're responding or doing the things they're doing. So
Mm-hmm.
does that answer your question?
Yeah, it does.
Okay.
That actually also applies to, let's say, general practitioners you talk to,
Mhm.
right? Do I have a provider who is listening
Yeah.
or who is just, um, following medical protocols there? So that's why I wanted to bring that up. It's not just about finding a mental health professional. I think it applies to general healthcare settings
Mhm.
as well.
Absolutely. I would, and that's why I say use universal precaution, because this isn't just, you don't only have to be trauma informed if you're a therapist or a social
Hmm.
worker. You should be trauma informed if you're a teacher, if you're a
Right?
doctor, if you're a
Yeah.
psychiatrist, uh, if you're the manager at a Starbucks.
Right. Right.
Like, there is no shortage of reasons why it's important for you to be trauma informed in your life. So yeah, I think it's pretty easy to spot.
Yeah. And, I mean, we are in a great position to have you as part of our, team. And we're excited to utilize your insights to train our Althing providers and
Mm-hmm.
sure they, implement the trauma-informed approach. And one of the items that we did was related to some de-escalation techniques that you trained them on. And I think that is another piece we wanted to talk about in this
Yeah.
podcast. Like, what are some things that you can share with our audience in regards to de-escalation when is needed?
Yeah. Yeah. There are quite a few. I will just say one thing before I get into the de-escalation techniques, that
Yeah.
as somebody who is like trauma and trauma informed care is something that I'm very passionate about. And it would be difficult for me to work for an agency that didn't expect trauma-informed approaches in all aspects. So like, fortunately for me with Althing, I mean, you guys have been on board with every recommendation that I have made
Mhm.
regarding trauma-informed. And if there were ever a place that I worked where their directives were not trauma-informed, and when I brought that up to them, they said, too bad, then that's not probably a place that I'm going to work. So
Yeah.
my advice to the audience is, if trauma informed is something that's important to you and you're working for a company that doesn't align with that, then I think you have a choice to make as to whether or not you want to continue working there, because you can inadvertently cause more harm than good. Um, so uh, so thank you for being so open to trauma-informed care. But yeah, so let's talk about de-escalation techniques, because sometimes, even when we are trauma-informed, even when we go out of our way to make sure that our clients aren't triggered, I mean, they might be triggered anyway, or they
Mhm.
might have come in triggered, and they're not in a place to be able to hear that you're not triggering them, or maybe somebody else triggered them and they're taking it out on you, right? So there might be times in which a person is incredibly escalated, and so I just have a couple recommendations for de-escalation techniques using
Mhm.
a trauma-informed approach. First and foremost, I would encourage you to try to stay calm yourself.
Mhm.
Now, again, I've nailed it pretty firmly that anybody can experience trauma, and we all may have triggers. I can't think of one person who likes being screamed at, whether you're a client or a provider, right? So that's really hard for us, as
Yeah.
somebody is screaming at us, to not want to run or
Yeah.
yell back, because we too have our internal responses. We have our inner parts that are telling us how to protect ourselves. So this can be something that you definitely need to practice at. But
Mhm.
I would encourage you that if it's possible, when somebody is screaming at you, try to stay as calm as you can. Because inevitably what will happen, well, what we hope would happen, is if they're screaming but you are talking in a lower voice, and a calm and
Mhm.
slower voice, theoretically they too will start to mimic that. They will
Mhm.
calm. So as long as you can stay calm and try to keep your voice calm, and just kind of be reassuring to them that you're listening, you're not trying to hurt them,
Mhm.
hopefully they can bring it down to
Mhm.
meet you at your level. So I would encourage you to mimic taking deep breaths. When they're yelling at you, take the time to visibly show that you're taking slow, intentional deep breaths. Keep the tone of your voice low. Relax your own posture.
Mhm.
Try to be in a relaxed, avoid crossing your arms or legs, but also create that spatial difference. And that's for your protection, but it's also for theirs too. So they don't think that you're trying to encroach on them. So again, that being very mindful of uh, the spatial distance between you. And then try to keep a neutral but warm face. So smile if appropriate, not
Mhm.
active listening, right? It can be very hard for us humans, and I'm sure people will agree with me that sometimes when people are talking to us, we are so busy thinking about our responses that we're not actually listening to what they're saying. So a great de-escalation technique is to practice active listening.
Mhm.
Maintain eye contact if it's appropriate. Again, we're not forcing them, but if
Mhm.
they are okay with eye contact, go ahead and maintain that eye contact. Use head movements to establish understanding. So nod your head where appropriate, shake your head where appropriate. Um, and then, pay attention to the words that they're using. Listen for what might have triggered them to have the trauma response in the first place. Because again, if you can figure out what triggered them, you can
Mhm.
prevent yourselves from inadvertently re-traumatizing them or re-triggering them again.
Mhm.
So I would encourage you to listen. I would validate their words and their emotions. Let them know that what they're saying and feeling matters, and that you are listening and empathetic to what they're going through.
Mhm.
Because if you think about it, right now, we're just trying to de-escalate. We're not trying
Mhm.
to solve their problems.
Right.
Validation is not necessarily an agreement of what they're angry about. It's simply recognizing why they're angry and empathizing with that. So in the interest of de-escalation, we're going to go ahead and validate whatever it is that they're saying.
Okay.
I would encourage you to ask open-ended questions because this shows genuine interest in their perspectives and their experiences. So an example of this would be, do you feel angry right now? Well, that's a closed-ended question because they can just come back with yes or no, but that doesn't really tell you anything.
Right.
So an open-ended question might be, it seems like you're pretty upset right now. Can you tell me what's upsetting you? Right? Ask for that explanation a little bit. Again, and I mentioned this earlier, if you're not really sure how to respond to them or they're crying, just as simple, how can I support you right now? What can I do for you? I'm here if you need me. Try to personalize. If it's somebody that you've never met before, let's say you work at like a shelter or something, or an agency that there's walk-ins, ask them their name. You know, it seems like you're really upset. What's your name? I want to help you right now, you know? If they're open to it, if like they still are kind of escalated even after all of that stuff, maybe suggest a walk or sit outside, like try to change the location because sometimes that can help to distract them long enough to get them to calm down. I would encourage you to be mindful of the language you're using and use positive language. So instead of saying, you know, I can't help you with that, say, okay, let me see what I can do to help. Because again, remember, in that moment, we're just trying to de-escalate the situation. We're not trying to solve their problems.
Yes.
But if you say that, let me see what I can do to help, what you're doing is just showing them that you're taking their problem seriously. You're understanding why they're upset. So, and then look for opportunities to build rapport with them. Look for things that you have in common. Now, if you're in a situation where there's a weapon, you know, you're going to go ahead and you're going to create distance. You're going to continue trying to utilize those de-escalation techniques as much as you can, but I would encourage you to look for help.
Right.
We have to protect ourselves too, right? I mean, trauma-informed care does not mean lay down on the line. It means
Yeah.
So I would take care of yourselves. If there is a weapon, you can use de-escalation techniques while also keeping yourself safe by creating the distance and looking for somebody to help you. Yeah, so that is what I have for the de-escalation techniques. What do you think?
I think there were, again, so many things to think about. And it's a very fascinating topic. And the more we dive into this, the more I feel like we should add additional episodes or, you know, additional conversations. And maybe if you would like to give our audience a little outlook on what we're planning next, they might appreciate that.
Yeah. Well, I'm very excited because we've invited some people to come and take part in our next podcast. We're going to have a guest panel, and we have 3 guests coming, and each of them all have experiences with trauma in their lives, and they're all at different places in their trauma recovery. And we've asked them to come and kind of share their experiences with us, and then also, you know, talk about how trauma-informed care has played a role in their trauma recovery and how important that is for them. So I would highly recommend people come and listen to that one because these women are amazing women that are coming. I am incredibly excited if you can't hear that. Yeah. So we have that coming up. We have a guest panel podcast coming up. And then after that, we are going to be shifting gears a little bit and talking about secondary traumatic stress. So we've been talking a lot about how you as the caregiver or the person can be trauma-informed care with other people. But let's not forget that we as helping professionals might also have our own trauma experiences that that can be triggered when working with other people.
Right.
Or we're working with people who have incredibly heavy trauma histories, and they're looking to us to help them heal with that. And now all of a sudden we start to notice that we're experiencing their same symptoms, right? So there's a lot of different workplace stressors that we as helping professionals need to be on the lookout for. And I have a whole presentation about that too. So we are going to be talking about secondary traumatic stress and some burnout and compassion fatigue and vicarious trauma more. So yeah, we have some exciting stuff coming up.
We do.
Yeah,
And thank you again, Christy, for taking the time to, share some of your personal experiences, some of the stories, some of the, insights with our audience. And I think it's incredibly valuable to just open up the conversation about this. And that's why we said initially, if our audience if they have any questions, any comments, any thoughts, please add them in the comment section, and we're happy to review them and include them in our next conversation and address them the best we can.
Yep. I look forward to reading what you all have to say. And I again, I love talking about this. So if there's any questions that you have that you want a little bit more clarification on, or any advice I can give, I'm here for it.
Wonderful. Thank you so much, Christy. We are so glad to have you, and I'm looking forward to our next episode.
Yeah. Thank you, Katya.
Thank you.